Namaste everyone, I am Dr. Amit here. Hope you all are doing great. Welcome back to my YouTube channel at the rate Dr. Amit Official, where we make medical concepts simple and practical. So if you haven't subscribed yet, don't forget to hit the subscribe button and stay updated with all our videos from all the subjects of MBBS. So in our last video, we covered the topic urea cycle from the biochemistry series. Today we are moving to an important clinical topic, hyperammonemia. Okay, so this is a must know topic for your NMCL exam, USMLE step 1 or step 2, and postgraduate entrance exam and MBBS professional exam. So I'll break it down in a simple, clear and exam oriented way for you. So stay with me and let's get started with our today topic. So our today topic is hyperammonemia. Okay, so what actually this term means? Okay, so it means increased ammonia levels in the blood. So suppose if ammonia fails to convert into urea, okay, or due to some problems urea cycle didn't occur in our body, then it will lead to increased ammonia level in our blood, okay, and that condition is known as hyperammonemia. Okay, now why this is dangerous? Because we all know ammonia is highly neurotoxic. That's why it causes brain dysfunction and causes encephalopathy. Now what are the causes of this? Okay, so one cause may be hereditary, that urea cycle disorder. Okay, we talked about urea cycle in the last video. So if suppose there is a deficiency of an enzyme, ornithine transcarbamylase deficiency. Okay, so if this enzyme is deficient, then urea cycle will not occur. Again, the ammonia will accumulate in our body. In the same way, we can talk about some acquired cause like liver failure. Okay, so liver failure because of cirrhosis or hepatitis. Okay, so we all know that this urea cycle occur where? In the liver. So in liver there will no conversion of this ammonia to urea. Again, it will cause accumulation of ammonia in our body. In the same way, there are some drugs called valproate. It also causes hyperammonemia as an adverse effect. Now suppose there is increased protein breakdown. Okay, suppose if anyone is in starvation or because of trauma, if the protein breakdown increases, then it also causes hyperammonemia like conditions. Okay, now let's talk about what are the symptoms, okay, we get in a patient with increased ammonia level in the blood. Okay, so while talking about the symptoms, the patient will have flapping tremor. Okay, flapping tremor, then slurring of speech, okay, like this, then somnolence, then vomiting, cerebral edema and blurring of vision. Okay, so this is all the symptoms we'll get in a person with high ammonia level in the blood. So let's see the symptoms in this figure. Okay, there's a flapping tremor. Okay, so flapping tremor like this. Okay, so flapping tremor, then slurring of speech, the patient is slurring of speech like this. Okay, then heavy head, somnolence, confusion. Okay, then the patient vomiting. Okay, then the last will be cerebral edema. Okay, your inside the brain there will be edema in the cerebrum. Okay, so cerebral edema and blurring of vision, the patient can't see properly. Okay, so the eye are blur, foggy. Okay, so flapping tremor, slurring speech, somnolence, vomiting and cerebral edema and blurring of vision. Okay, these are the main clinical symptoms you'll get in a patient. Okay, so just remember this figure and you can remember all the symptoms. Now after knowing the symptoms, I'll explain these 3 steps. Okay, it's very important. Okay, just pay attention. Okay, so alpha ketoglutarate. Okay, we get alpha ketoglutarate from TCA cycle, Krebs cycle, right? So alpha ketoglutarate mixed, so NS3 comes over here. Okay, and while adding both it forms glutamate. Okay, and this glutamate form glutamine and GABA. So ammonia also add over here in the glutamate and glutamine is formed. Okay, now we'll talk one by one about all these. Okay, so this glutamate, okay, so this glutamate function is actually, it is a neurotransmitter. Okay, and its function is excitatory in the brain. Okay, excitatory in the brain. Okay, now talking about this GABA. Okay, it's an inhibitory neurotransmitter, so it actually decreases the anxiety, seizure and neuronal activity in normal conditions. Okay, in normal conditions glutamate is excitatory and GABA is inhibitory. Now talking about glutamine actually detoxify ammonia. Okay, now suppose in case of hyperammonemia, okay, ammonemia, when there is more NH3 in the blood, more NH3 will combine with alpha ketoglutarate, and that will lead to what? Decreased TCA cycle, or TCA cycle will slow down, then there will be less formation of ATP. Okay, one condition is this. Now second condition is more glutamate will form more glutamine. Okay, and there will be less glutamate, because if there is more ammonia, then more ammonia will combine with glutamate to form glutamine, and the glutamate condition number will decrease. And if glutamate condition will glutamate number is decreased, then the excitatory neurotransmitter will decrease in the brain, and it will cause less excitation in the brain. It will cause confusion. Okay, so the second symptoms is confusion in the patient. Now talking about the glutamine, if there is more glutamine, okay, when the NH3 level will increase, then more glutamine will form. So if glutamine will access in our body, then it will cause astrocyte swelling and finally lead to cerebral edema. Okay, so this is how cerebral edema is occurring in patient. Confusion is occurring in patient. Okay, and this is how the more hyperammonemia affects TCA cycle. Okay, now we'll move further in this lecture and talk about lab findings. Okay, so lab findings of hyperammonemia patient will be increased ammonia in the blood, but there will be decreased blood urea nitrogen. Why blood urea nitrogen will be decreased? Because the ammonia is not participating in urea cycle. So when urea cycle will not occur, then the urea will be less in the blood. So that's why blood urea nitrogen will be less. Okay, now coming to treatment part. Okay, so the acute management is reduce ammonia fast. Okay, if any patient is very severe, then the first thing is reduce ammonia fast. Second is limit protein in diet. Okay, so give limit protein in the diet of the patient. Okay, the third thing is to decrease ammonia level. We can give lactulose. Okay, why? Because this lactulose will convert the ammonia into NH4 plus, and this NH4 plus will trap ammonia in the gut. Okay, and that will decrease the level of ammonia. And then we can give antibiotics. Why? Antibiotics like rifaximin. Okay, so it reduces ammonia producing bacteria. Okay, so this rifaximin kills the ammonia producing bacteria. Then in severe cases we can opt for dialysis. Okay, now there are some ammonia scavenger. Okay, so it actually form a product that is excreted renally. Okay, so like sodium benzoate, sodium phenyl acetate, and sodium phenyl butyrate. Okay, so this is all the management part in case of hyperammonemia. Okay, so this is all about hyperammonemia. I think this much is enough to solve the MCQs for NMCLE, USMLE step 1, step 2, and PG entrance exam. So if you like this video, please share with your fellow medicos and friends, and in your medical college groups. Please do subscribe my YouTube channel at Dr. Amit Official. We'll meet in the next video with a very important topic. Okay, so stay tuned, keep work harding. Thank you.